Hello, doctors. You might be making this mistake in your clinical practice. The patient presents with the particular symptoms or complaints, and the moment the patient start mentioning about some different pathy, different system of medicine, the doctor starts blaming or complaining. I'm not talking about all the doctors, but many of the doctors do this mistake. So they, irrespective of which pathy they are into, they will start blaming the other pathies. They will start claiming that that pathy does not work. That system of medicine does not work. My dear doctor friends, uh, it might be possible that you might not be aligned with another pathies or another system of medicine, but irrespective of that, that's not the way how you present yourself in front of your patients. That is the first thing. That's definitely not the professional way, because it's creating a certain kind of image uh, in front of the patient. Your intention might be pure. You definitely want to help the patient. You want patient should not deteriorate his health. Your intentions might be very pure, but the way you present that information uh, will create a certain image of yourself in front of that patient. That patient might start creating certain stories or certain impressions about you. This doctor is blaming other pathies, so he might be doing for his own personal interest. So at that point of time, your intentions may get diluted. So that's why, first of all, even if you are not aligned with other systems of medicine or other pathies, that's not the way to present yourself in front of the patient. You can, even if you want to do, you can do more in favor of your own pathies instead of uh, blaming other pathies or finding some fault in other pathies. You try to show how your pathy is more evidence based or how scientific it is. That is the way you can do it. You can showcase the research findings or the outcomes of your pathy. That is the first way. Another way is on the professional forum or on the professional platforms. You will definitely come across these kinds of incidences, particularly on the news channels, because news channels want TRP. Few days back, I was watching this news, uh, and that news anchor, they bought two different doctors from two different pathies, and those two doctors started fighting on the camera. That's very unprofessional for both the doctors, for both the pathis or both the system of medicine, and as a overall healthcare system professional. So that's not the right forum, because those news channel, they feed on that kind of debate and discussion and differences. uh, I'm not saying that one or other pathy or one or other treatment or procedure or some medicine is right or wrong. I'm saying that even if you want to raise some concerns, do it in a proper way. You utilize your medical associations. They are the one of the right channel. You can approach to government or the approving agencies or the relevant medical councils. You can conduct some research, and that's how, on the based on the scientific evidences and the data, you can prove how your pathy is working for particular medicine or some condition or certain medical disease. So there are different ways. I'm just giving some of the examples. So the point here is not like how you should be behaving, but avoiding this kind of mistakes, particularly in front of the patients. That is my sincere request to you. Irrespective of which pathy or which system of medicine you are following, never like misrepresent yourself in front of your patients, because that creates a certain kind of image in that patient's mind, and we want to avoid that. You might be right, you might be wrong. That's not the The point here is how you present yourself in front of your patients. So I hope you found this observation useful. Please do share with your friends. Also, let me know your thoughts, how you would like to tackle this situation, or maybe if you have experienced this kind of situation, maybe as a professional or maybe as a patient. You can let me know your thoughts in the comment section. Uh, so any pathy is not good or bad or not better or worse. Every system has their own pros and cons. So it's up to the patient's choice. But irrespective of that, irrespective of your pure intentions, the presentation should be in a more professional way. So that's all for now. This is Dr. Nitin signing out. Bye bye.